Welcome to part 1 of nursing practice questions and answers about renal and urinary problems of the adult clan. Now, let's start with the first question. A clan with acute kidney injury has a serum potassium level of 7.0 millimole per liter. The nurse will plan which actions as a priority. So select all that apply. So these are the options. Option A, place the clan on a cardiac monitor. Option B, notify the primary healthcare provider. Option C, put the clan on NPO status except for ice chips. Option D, review the clan's medications to determine whether any contain or retain potassium. Option E, allow an extra 500 ml of intravenous fluid intake to dilute the electrolyte concentration. Now, for this question, the correct answer is option A, place the clan on a cardiac monitor. Option B, notify the primary healthcare provider. And option D, review the clan's medications to determine whether any contain or retain potassium. Now, let's move to the rationale. The normal potassium level is 3.5 to 5.0 millimole per liter. A potassium level of 7.0 millimole per liter is elevated. So the clan with hyperkalemia is at risk of developing cardiac dysrhythmias and cardiac arrest. Because of this, the clan will be placed on a cardiac monitor. The nurse needs to notify the primary healthcare provider and also review medications to determine whether any contain potassium or are potassium sparing. Now let's move to the second question. A client with chronic kidney disease being hemodialyzed suddenly becomes short of breath and complains of chest pain. The client is tachycardic, pale, and anxious, and the nurse suspects air embolism. What are the priority nursing actions? So select all that apply. So these are the options. Option A, administer oxygen to the client. Option B, continue dialysis at a slower rate after checking the lines for air. Option C, notify the primary healthcare provider and rapid response team. Option D, stop dialysis and turn the client on the left side with head lower than feet. Option E, bolus the client with 500 ml of normal saline to break up the air embolus. For this question, the correct answer is option A, administer oxygen to the client. Option C, notify the primary healthcare provider and rapid response team. And option D, stop dialysis and turn the client on the left side with the head lower than feet. Now let's move to the rationale. If the client experiences air embolus during hemodialysis, the nurse will terminate dialysis immediately, position the client so that the air embolus is in the right side of the heart. Also, notify the primary healthcare provider and rapid response team and administer oxygen as needed. Slowing the dialysis treatment or giving an intravenous bolus will not correct the air embolism or prevent complications. Finally, let's move to the third question. A client arrives at the emergency department with complaints of low abdominal pain and hematuria. The client is febrile. The nurse next assesses the client to determine a history of which condition. So these are the options. Option A, pyelonephritis. Option B, glomerulonephritis. Option C, recent trauma to the bladder or abdomen. Option D, renal cancer in the client's family. Now, for this question, the correct answer is option C, recent trauma to the bladder or abdomen. Now, let's move to the rationale. Bladder trauma or injury needs to be considered or suspected in the client with the low abdominal pain and hematuria. Glomerulonephritis and pyelonephritis will be accompanied by fever and are thus not applicable to the client described in this question. Renal cancer will not cause pain that is felt in the low abdomen, rather the pain will be in the flank area.